What they've got now is they've got the computers, the textbooks, the lunch, and they carry their own water. For some reason, it's no longer appropriate to just go to the bubbler or get a drink from whatever. Kids take their own water bottle, and these days the water bottles are big, and which is I spend a lot of time telling patients not to carry or repetitively lift more than 20 kilograms as an adult. And so, 20 kilograms in an adult is say sort of 25, 20% of body weight. Whereas my 35 kilogram daughter has a 10 kilogram, bag. When the cartilages are softer, and so increasingly, sort of younger people are ending up with back problems because they're just physically carrying too much weight. And in an era where we're supposed to be carrying less. Certainly my daughters and, if you look around at lots of school kids, they're all carrying these incredibly heavy weights. I've had a couple of patients come in with 17 or 16, 17-year-old kids with disc problems, and who parents are saying, oh, look, they've been carrying around these heavy bags for the last few years. Could that have caused the problem? And the answer to that is almost, it may well have, because, cartilage doesn't repair itself. And if you put stress on it, and there's a lot of emphasis on use it or lose it kind of thing by the physios and so forth. But at the end of the day, the more repetitive action you put through a joint, the more you wear it out. And the more axial loading you put on it, the more you wear it out. And so, I keep, sort of picking up my daughter's bags going, and kids just seem to be carrying more and more. I initially saw it with Savannah when she was, going through, but, her bags, don't change. There's multiple books, there's a laptop, the laptop's a kilogram, 1.5 kilograms, the water's a kilogram, the books are more. And so they're carrying maybe 8, 10 kilograms, which is a huge amount proportionally. It's a pet thought project for me, and it's a reasonable thing for me to speak out about as father of two daughters, as a spine person. Um, and no one's, it's not something that's anyone's, there's certainly nobody making any noise about it. I mentioned it just even last Friday, and Anastasia said, yeah, she said, you see these little kids getting out of the car, sort of, with putting the things on and walking out with these huge weights. And there's no ceiling on it. Like, kids are just like, oh, whatever it is, you got to carry. There's no regulation about it, and and kids are wearing it, or carrying them. If an adult was putting that amount of weight proportionally through their body, OH&S people would be stepping in and saying, "I'm sorry, this is inappropriate for you to make an adult put this weight through their spine." Because the proportional weight would be, maybe 25, 30 kilograms, and under OHS guidelines, no one's supposed to carry or, sort of that kind of weight. Probably until a school's taken to task for it. I guess the question's going to be who's actually responsible for what goes in your bag, for your school bag. I certainly I operated on a girl I think about a year ago. I think I operated, I can't remember because there's a few HSC level kind of like year 10, year 11 school kids, um, who had problems in their last year of school as a result of it. Which my side, I'd like to say, oh, yes, it's an explosion and it's an epidemic, and there's increased incident. I'm not quite sure I can say that, but certainly I've not seen as many school kids as I've seen in the last few years. Like I don't remember seeing school kids with significant back problems, you know, 20 years ago. You've got to say at the end of the day, if you're putting significant compression through the spine onto your cartilage, you're causing it damage at a young age. And the whole problem with cartilage is the cartilage you have at 15 is the cartilage you've got at 85. It doesn't repair itself, it doesn't regrow. So whatever damage you do to it as a child, it can haunt you for the rest of your life. And set you up for back problems. So yes, that's correct. So, a bit of prevention, is worth a lot of cure for this. So yeah, I must say, I do. I think it's a real issue.